I'd like to take this opportunity to thank the community for all of the support in helping us to keep our doors open and to continue serving the cancer patients of our community. 2020 was an extraordinary and challenging year, as we all know, and yet it was a year of so much generosity, perseverance, determination, kindness, and appreciation for one another. Our CRCD team adapted our services to be safely provided during this pandemic crisis. We expanded our telehealth services and conducted face-to-face visits with our patients using the appropriate safety precautions. We also continued to see patients at the ECRMC Oncology Clinic. With all of these changes, it forced us to really be creative. And what came for us was the generosity of our community. Our community really stepped up in helping us to provide personal protective equipment, funds to be able to provide nutritional support, also monies to help with rental and utility assistance. In 2020, CRCD served 390 patients. These 390 patients were seen 3,844 times by our team of 7 navigators. We've spent thousands of hours working with them and for them. CRCD facilitated $337,000 medical expense relief, which is direct out-of-pocket expense relief for our cancer patients. We also garnered $108,000 of grant assistance, that is direct support for our cancer patients. And it's so important for us to continue to make ourselves available during this stressful time. The fearfulness that the pandemic has caused has disrupted and delayed treatment, and what we have been able to do is support our patients during the complex time to get to their different treatment protocols. CRCD has partnered with multiple academic institutions to conduct research for our patients. One of those research projects, which is working with reproductive health in a survivorship care plan, also included helping for the first time a 32-year-old Latina breast cancer patient who was going to begin her treatment for triple-negative breast cancer. That's a very aggressive breast cancer that is prevalent in Latinas. What we did was we were able to facilitate fertility preservation for her in the month of December. It took extreme coordination of medical physicians and surgeons and fertility planning clinic to mobilize to accomplish this. Within a 2.5-week period, we were able to help this woman get ready for treatment, obtain her surgery for her Mediport, begin all of the hormonal therapy that she was going to need, and ultimately have harvesting of what are 15 of her eggs that are now frozen, and then the day after, which was the last week of December, she was able to begin her oncology treatment. So we're extremely excited. It is the first time we've ever been involved in something like this. I believe it may even be the first time something like that happened with our local Imperial County for something so generous to occur. We have a private benefactor that's been supporting us with this, and I just have so much admiration for the courage and willingness of all parties involved, from the patient to the medical providers, and for the team that we have that works so closely together in helping to accomplish this. So that's an update on our survivorship care planning and reproductive health research study.